Whilst there is some evidence in some areas that we are improving brain health, we need a large focus from our community on how we can improve our brain health.
This is Brain Awareness Week, and recently a survey showed 66% of Canadians have identified having a loved one impacted by a brain disorder. The most common brain conditions are stroke, dementia, and depression. Brain conditions don't just affect adults and the elderly.
So the most common age of onset for almost every single kind of mental health condition and addiction is in adolescence and young adulthood. And in fact, if you look at the prevalence of mental illness amongst the population, the highest rates of prevalence are in those who are adolescents and young adults. So mental illness is a condition that affects young people. And the beginnings of many of the other brain conditions are seen there.
Dr. Levitt also has tips for people to improve our brain health.
Time is brain. That is, the amount of time you wait before you start getting help affects the brain. And so the sooner one can go for help, educating oneself about what the early signs of stroke are, understanding what Alzheimer's or dementia is like, and understanding depression and the early symptoms of depression. The sooner we get in and can get treatment, the better. So there's preparation, such as exercise, diet, and healthy lifestyle. And then there is understanding the symptoms and seeking help and treatment as early as we possibly can.
Sunnybrook Hospital is currently building and taking donations for the Gary Hurwitz Brain Sciences Center, the center that will offer revolutionary solutions to the most devastating brain disorders of our time, including stroke, dementia, and Alzheimer's. It will be completed by 2023. In Toronto, I'm Brandon Rowe for City News.